Welcome back to my channel, everyone. Today, I will introduce you to a new series of videos called Refill Day. We all need a good refill once in a while. In this series, I will answer a general question or concern that I will pick from you, from the comment section, or from the most asked and interesting questions that I get at the pharmacy. All health and medication information will be evidence-based. However, keep in mind that all information that I provide should not be considered as personal medical advice. It's general information for which you need to consult your pharmacist or your physician to find out if it applies to you. Because let's be real now, they have your medical record, I don't. They have your history, I don't. And they can follow up with you. On this first episode of Refill Day, I will answer questions that I've been getting a lot ever since that COVID-19 saga started. Is it okay to take during this COVID-19 pandemic an anti-inflammatory such as Ibuprofen, also referred to as Advil and Motrin, which are brand names? Before I answer this question, please note that this video was recorded on April 1st, 2020. So the information in this video is up to date up until this date. Okay, first, let me give you some background on where this anti-inflammatory concern comes from. We have data from studies in the past that speculate that anti-inflammatories might increase the risk of complications when taken during a respiratory infection. Also, recently, in the midst of this COVID-19 pandemic, many news reports have stated that the use of anti-inflammatory drugs can worsen COVID-19 symptoms. These reports stem from a letter published on March 11, 2020 in the Lancet Medical Journal. Now let's revert back to your biology classes. This letter in the Lancet suggested that anti-inflammatories increase the amount of some receptors located on specific cells in your body. Those receptors are called ACE2 receptors. And the report also suggested that the increase of ACE2 receptors could result in the aggravation of COVID-19 symptoms. Considering that the coronavirus uses this receptor to bind to some cells in your body, including your lungs, and that bind makes it possible for the virus to enter your cells and get you sick. Are those reports enough to say that the use of anti-inflammatories are for sure dangerous during this pandemic? According to the FDA and Health Canada, no, because those reports are based off limited research. The very few studies mentioned in the Lancet article were targeting COVID-19 patients with severe symptoms, who already had chronic health problems, and who were taking a specific type of high blood pressure and heart medication called ACE inhibitors and ARBs. According to animal studies, those types of medications are known to increase the ACE2 receptors that I was telling you about earlier. And like I said, that increase can make the coronavirus operate more efficiently in your body. However, the problems are that no clinical studies have shown a significant ACE2 receptor increase by medications on humans. It's only been observed on animals. Also, no clinical studies have shown that the use of anti-inflammatories increases the risk of developing severe symptoms of COVID-19. The current reports have simply extrapolated animals' observations with ACE inhibitors and ARBs to anti-inflammatory drugs. Because anti-inflammatories can also boost ACE2 receptors on the surface of cells. The FDA and Health Canada need more scientific and clear evidence before connecting anti-inflammatories to the worsening of COVID-19 symptoms. It's simply too early to make such connection because, let's face it now, before we condemn anti-inflammatories without any doubt, we need more studies that will tackle this matter from different angles. First, we need to know for sure if anti-inflammatories and other medications significantly increase the ACE2 receptors on human cells, not only on animal cells. We need studies that will focus directly on anti-inflammatories. And will the result be the same if we assess Younger and healthier patients as opposed to older patients with many health problems? And if we put aside medication use, are there other factors that can cause the worsening of COVID-19 symptoms? For the moment, there are many questions that are left unanswered, not only for anti-inflammatories, but also for ACE inhibitors and ARBs. That is why the FDA and Health Canada won't make a definite assessment from only a few available and sufficient studies. However, they will continue to monitor the situation and keep us posted if there are any new developments. For the moment, if you don't want to worry about it or take any chances, here are the recommendations. If you have COVID-19 or symptoms similar to COVID-19, such as fever with cough, fever with difficulty breathing, consider another fever and pain relief medication, such as acetaminophen. Always read and follow the instructions that are on the box label before you use it. And go to your pharmacist, or in this COVID-19 context, rather call your pharmacist to make sure that the alternative meets your needs and is compatible with your medications and with your conditions. If you've been prescribed an anti-inflammatory for chronic pain, continue your treatment. If you want to absolutely stop it, or if you present any symptoms of COVID-19, consult your health professional before doing anything. I hope you guys appreciated this first episode of Refill Day. And rest assured, because I will keep you posted if there's any update with this matter with anti-inflammatories. If you want a written summary of this video, feel free to visit my blog. The link is down in the description box below. If you enjoyed this capsule and want more of them, don't forget to like this video, subscribe to my channel, and turn on that notification button to not miss a thing. And feel free to leave a general question down in the comment section below, because you never know, I might take your question for one of my next Refill Day videos. Finally, continue to refill your life, and I'll see you when I see you.